And news that's coming in, Mira now confronted Maharashtra Minister of State for Health, Rajendra Patil, on lockdown violations in containment areas. The minister said that a complete lockdown could be imposed in those areas where cases are rising, but the norms are being flouted. Listen in.
जिस एरिया में पेशेंट बढ़े उधर लॉकडाउन किया, अभी उधर का टेस्टिंग की संख्या जो है वो बढ़ा रहे, जो सेफ्टी मेजर्स करने के लिए लेने के लिए आते हैं वो सब कर रही है सरकार। अगर ऐसी ज़रूरत पड़ेगी तो लॉकडाउन किया जाएगा, जो मेजर्स सेफ्टी मेजर्स लेने की ज़रूरत है। लेकिन दूसरी बात भी है, एक है कि डबलिंग रेट जो है उसमें भी दिन बढ़ेगा अभी। इसलिए ऐसा नहीं है कि वो डबलिंग रेट वो लगातार बढ़ रहा है, ऐसा भी नहीं है। डबलिंग रेट में भी अंतर पड़ रहा है। जिधर ये लॉकडाउन का और जब लॉकडाउन ख़त्म होने के बाद जो गलत इस्तेमाल जिधर होगा उधर फिर से लॉकडाउन करेंगे, ऐसा सीएम साहब ने बोला है पहले ही।
Meanwhile, certain areas in Mumbai, new hotspots are now emerging. So Mulund, Bhandup areas in the eastern suburbs are some of those areas which are seeing a rise in the number of COVID cases in the last 1 week. These areas were once at the bottom of the list are now with the highest growth rate of COVID cases. The civic body says that there are cases from slum pockets in the areas and there is a lack of social distancing as well. And meanwhile, the civic body has taken a slew of measures to try and curb the spread of the coronavirus in some of these new hotspots that have now begun emerging. Meanwhile, containment efforts have been a complete sham. As far as Malad area in Mumbai is concerned, Somwar Bazar, a containment zone, continues to be crowded all through the day despite the norms being enforced, despite the area being barricaded. People were found making their way through 10 sheets with no authorities to monitor these violations. Santya sends us this report.
BMC is marking the problematic areas as containment zones and on paper giving orders that nobody will be allowed to enter or exit the containment zones if they are not associated with essential services. Non-essential commodities shops will not be allowed to remain open in the containment zones, and no vehicular movement will also take place. But the reality on ground is absolutely opposite of the BMC orders. This is Mumbai's Malad area, Somwar Bazar in Malad, one of the containment zones. And it's not, and this area, of course, you can see in the name of ensuring that nobody comes out of the area or enters the area. Tin sheds are used here, but a gap is here, and using this gap, people are entering and exiting the area freely without any restriction. And there is no one from the authorities, neither from the local police nor from the BMC, to man the area to ensure that people do not violate the guidelines of the containment zone, and it clearly is not helping. Now the entire purpose of marking the problematic areas as a containment zone is the areas which are marked as containment zones to contain the spread there. Lockdown is implemented in these areas so that the rest of the region do not have to go through the harsh guidelines of the lockdown, and only the problematic areas, the containment zones, are under that lockdown. But on ground, those containment areas, and it's not just Somwar Bazar of Malad, many more parts of the region, of the city for that matter, are declared containment zones only on paper, and absolutely no implementation of any of the guidelines of a containment zone on ground is happening.
Meanwhile, Indiranagar, a neighborhood in Mumbai's Mulund area, has seen over 100 cases as well of coronavirus in the past few days. And despite it being declared as a containment zone, the area has not even been barricaded, nor are the authorities deployed to check on violations. The residents are in fact found moving about freely without any kind of lockdown norms being maintained. Disha Shah sends us this report.
Well, that's right. Mulund and Bhandup have now become the new hotspots here in the city of Mumbai. Mulund, where I am standing right now, has the highest growth rate at 3.7% against Mumbai's average growth rate, which stands at only about 1.88%. So you can see that how the area has seen significant jump in the number of COVID positive cases only in the past 1 week alone. In fact, I am here standing at Indira Nagar, which is one of the containment zone in the city of Mumbai. And as you can see, this particular containment zone, it has been contained only with, bamboos. No board as such of the containment zone has been put up here, as you can see. If we move a little bit closer to this particular location, it is very huge as far as the population density is concerned. It consists of buildings as well as slum pockets. And you can see that how people can be seen roaming very freely here in this particular locality, which is under a containment zone for the last 2 months, because this particular area has seen over and above 100 positive cases in the last 2 months alone. And as you can see, there has been no measures that have been followed by the citizens at all. If you move a little bit ahead, you can see that how these, snack counters are also open, which is obviously a violation. You can see that how people are standing here without wearing any mask, without maintaining any social distancing norms. You can see the food counters are open. This is a complete violation in a containment zone. Only medicine, like medical stores and milk stores is allowed to remain open. But here you can see that this is an entire violation. Even the hardware store is being opened as we speak. So, considering to all of these violations, Mulund and Bhandup, which have been once at the bottom of the list, have now, topped as far as the growth rate is concerned. And this is one of the concerning and alarming, for the BMC here in concern, because these are the new hotspots that now they have to deal with. So, since yesterday, they have started door-to-door survey and screening of people to find symptomatic patients, and mobile vans have also been deployed in several of the sensitive locations is what we understand, and swab test will be taken so that immediate treatment, immediate testing can be done. Specifically in such locations where the density of the population is extremely high, they are following the 1:20 ratio, where behind every positive patient, they will at least institutionally quarantine 15 to 20 specifically from the slum pockets. So this is how they plan to curb the infection, just like how they did in Dharavi, which has now seen a flatten, which has now seen a decrease in the number of cases. The similar method they are trying to adopt in these newer hotspot areas as well. With video journalist Tushar, this is Nisha Shah reporting here from Mirana from Mumbai.